our August gathering. On behalf of Brio International Nurturing Academy, I, Shruti Singh, proudly welcome you all for this one-day e-certificate awarding webinar on impact of COVID-19 infection on pregnancy and breastfeeding. Once again, I would like to extend my heartfelt welcome to all dignitaries, resource person, Miss Itisha Rose Prasad, and dear nursing professionals. Before proceeding up, let's stick to our webinar rules. That is, keep yourself mute, keep your video off, be attentive, and drop your queries in chat box if any, or at the end, you can interact with our resource person in order to clear your doubts. Now, dear participants, let me walk you through our BIN Academy. So this is our academy, and we have a coach, new beginning, and with new mindset, and a new start, and a new focus, and a new start, and a new intentions, and of course, a new results. And that is our quote, and we are with you. That is our BIN Academy, and be with BIN Academy. Brio International Nurturing Academy. In short, BIN Academy is an online and offline educational and research academy based in India, which is registered under MSME, Government of India. BIN Academy offers wide range of educational topics for faculties and students of medical, nursing, and paramedical stream in their career development. So let's enter into our webinar. Let me take this privilege to introduce and welcome our resource person and eminent speaker of this webinar, Ms. Itisha Rose Prasad. To talk about Madam's education, Madam has completed her BSc Nursing from Peachy College of Nursing in Gwalior, and Madam has completed her MSc Nursing with a specialty in obstetrical and gynecology nursing from Choithram College of Nursing in Indore in Madhya Pradesh. Madam has more than 3 years of teaching experience, and presently she is working as assistant lecturer in St. Jude College of Nursing in Jhansi, Uttar Pradesh, India. Madam is also a member of Society of Midwives of India, SOMI, and Trained Nurses Association of India, TNAI, and National Research Society of India, NRSI. To reflect Madam's extra qualification, Madam has worked as a child development programmer organized by Compassion East India. Here we have our next slide, please. In 2017, Madam has done online certification course of Health Research Fundamentals under ICMR. And Madam has also done training on basic holistic health and food reflexology from Holistic Health Education and Healing Center from Pune. Madam has also done a special training on aromatherapy, acupressure, yoga, and deep breathing during various stages of labor under Aegis of Society of Midwives in India, organized by Choithram College of Nursing, Indore. Even Madam has got Best Paper Award from her mixed method research in an international conference. Madam is a co-founder and expert editor of Baby Stories. Online, you can get many articles from her site. And Madam has attended workshop on data analysis using SPSS software conducted by Brio International Nurturing Academy. Even Madam has participated in many international and national conferences. Madam has crossed the boundaries of excellence with her great spirit towards nursing profession. I warmly and respectfully welcome you, ma'am. And now it's over to you and the stage is yours. Please welcome ma'am.
Well, thank you so much. I hope I'm audible to everyone. It was indeed a really warm welcome. I thank the BIN Academy for welcoming me. So now, a very good afternoon to all the beneficiaries present here. Indeed, I should not say a good afternoon. I should be saying a very bright and a vibrant and as well as an energetic afternoon to all the people who are listening to this webinar right now. It is indeed my privilege and my honor to be able to speak in this webinar. Now, without wasting much of your time, let me quickly take you to the detailings of today's webinar. The topic that has been selected for today's discussion is impact of COVID infection on pregnancy and breastfeeding. So I guess everyone is having a lot of knowledge about COVID, right? Because a lot has been talked, a lot has been heard about COVID infection. Now, when we talk about pregnancy and breastfeeding, pregnancy in itself is having a lot of, during this period, the mother in herself undergoes a lot of physiological and immunological changes. As a result, the mother is always prone to various kind of infections, and that is why she is asked to be overprotective. She is asked not to eat certain food. She is asked not to go certain way, at certain places. Why? Because with her, some other life is also related, and as such, whatever mother is going to eat, whatever mother is going to drink, it is obviously going to affect the growing fetus inside. Now, talking about COVID in itself has taken a lot of great toll on human life, be it the young people, be it adult group, be it old age group, everyone is affected, right? So now when it comes to pregnancy, breastfeeding, childbirth, it is not something which is biomedical. It is a very much natural phenomena which takes place naturally, right? And it doesn't wait for the COVID to go on. Obviously, life should go on, right? So now how can we protect our pregnant mommies? How can we protect and how can we encourage and care for our breastfeeding or lactating mothers when in case they get COVID positive? So this discussion which is kept today is basically about the impact of COVID infection on pregnancy and breastfeeding. So let's quickly go ahead. These are the outliners for the day that we are going to discuss today. First is effect of COVID infection on pregnancy. Second is effect of COVID infection on the fetus. Third, we are going to discuss about the care during pregnancy in case of COVID pandemic. We will even discuss about the postpartum care in case of COVID infection. Now, care during pregnancy will include both the things, that is the antepartum care and the intrapartum care, as well as the postpartum care also. Next, we will also discuss about the breastfeeding during COVID pandemic. Now, before moving into the detailing of every topic, I would like to just have a very precise and a very quick review about this COVID with everyone over here. COVID, I guess everyone knows, right? COVID stands for, COVID is basically an acronym which is standing for Coronavirus Disease 2019. And talking about its occurrence, so this COVID, I guess right now it is 1.5 years old. Yes, so COVID is 1.5 years of age. It is this novel coronavirus actually came in, first of all, in Wuhan city in mid of December 2019. After which WHO, that is World Health Organization, had actually first declared this coronavirus as a public health emergency of international concern, which on 30th of January 2020. After which it was declared as a pandemic on 11th of March 2020. Now, after revising all the basics of COVID, now it is important for us to know about the incubation period of COVID-19 as well. So now basically when we talk about incubation period is something which is a time period from the infection till the occurrence of the symptoms. So from the time between the infection and the occurrence of symptoms of COVID-19, specifically in general population as well as for the pregnant mothers, it remains almost similar, right? So in case of general population, we have already read a lot about it. That is, on an average, it is about 5 to 7 days, which can also be increased up to 14 days. So this was about the incubation period of COVID-19. Now, this is the first main topic of today's discussion, that is risk of coronavirus on pregnancy. As I already said, pregnancy is a period which is considered in which the mother is already prone to a lot of infections. Why? Because the maternal body undergoes a lot of immunological changes, the mother's body undergoes a lot of physiological changes, which results in lot many infections, lot many problems which occurs along with the pregnant mothers. If in case, on top of that, maternal body is associated with some kind of medical problems, be it heart diseases, be it hypertension, be it diabetes, if any other such comorbidities that are attached, then definitely the risk in case of non-infected COVID pregnant mothers also is very high. Now, talking about COVID, whether this COVID infection is very much infectious for the pregnant mother as compared to the general population, Then talking about this topic, the ICMR basically stands for Indian Council of Medical Research. So now our Indian Council states that pregnant women do not appear more likely to contract the infection as compared the, just one second, I'm sorry. Yes. ICMR states that pregnant women do not appear more likely to contract the infection than the general population. That means when we compare the pregnant mothers and the general population, definitely pregnant mothers are more prone to infection because their immunity is less. But in terms of COVID infection, the ICMR clearly mentions, not just ICMR, talking about the other health organizations like WHO or FOGSI, every of the large-scale organizations, their recent research studies, they have proven that pregnant mothers are not very much likely to contract infection at a higher rate than the general population. Okay, but obviously exceptions are everywhere. In case of talking about pregnant mothers, if in case with a pregnant mother, any of the comorbidities attached, any other pregnancy related medical issues are attached, if there's any past medical history, past surgical history, which is making the mother prone to any kind of infection, then that definitely. So first, let's discuss what are the certain infections which can be a risk factor in case of COVID. So if a mother is having hypertension, that means preeclampsia, eclampsia, gestational hypertension, if any kind of hypertensive disorders are present, or maybe the mother is having diabetes, maybe the diabetes in the gestation period she got, that is gestational diabetes mellitus, or maybe from before in the pre-pregnant state also she was diabetic previously also, that means right now she's a diabetic mother from the childhood or from the adulthood in the pre-pregnancy state itself, or maybe any kind of heart diseases, be it congenital, be it acquired heart diseases, as well as certain immunocompromised conditions like hepatitis, like HIV, and certain other conditions. Definitely, if in case the mother is having any such of these conditions associated with her pregnancy, then that is definitely going to result in an increased risk of COVID-19. So now if we say that pregnant mothers, whether the pregnant mothers are at a more risk, so definitely not. Pregnant mothers are definitely not at a higher risk of getting infection as compared to the general population. But if in case pregnant mothers have some comorbidities attached with it, then definitely they are at a high risk. Now, talking about the particular effects which the COVID-19 has on the pregnant mothers, first of all, before I bring on the next sentences over here, I want to make it very clear that as we know that COVID is a very recently occurring disease, right? So not many researches and evidences are available on this till now, till date, but based on the evidences on researches, whatever is available, it is very much clear that this COVID-19, if in case a pregnant mother gets COVID positive, either during any period of gestation or during the time of delivery, it can impact to a minimum extent to the newborn also. So talking about pregnancy stage, there is increased risk of more preterm deliveries as compared to the non-infected cases. That means if in case a pregnant mother becomes COVID positive, then definitely there are chances of preterm deliveries. Next is there's increased risk of prenatal anxiety, there's increased risk of prenatal depression. Now, why is there a chance of prenatal anxiety and depression? But obviously, this is a very common sentence which I have written over here. Mothers are definitely more concerned about the baby. Even if during pregnancy, she gets a lot of nausea, she gets vomiting, if she gets a headache, she gets a swelling in the foot, she is getting a backache. First thought that she gets in her mind is my baby okay? Is my baby all right? Whether my baby is doing good? Will it not affect my baby? This is the first thought which the mother gets, right? And now since it is COVID is something which has affected every age group. So now mothers obviously know that COVID is something very severe and it is, what should I say, it is some life-taking disease it is, right? So definitely they are going to be very much affected in case if they themselves become COVID positive. So they are going to become anxious, depressed, and the other reason which I have thought because of which I become very anxious and depressed is staying at home. Staying at home, usually it is said everywhere, please stay at home, stay safe, try not to go outside of your houses. Now, when it comes to pregnant mothers are asked more to stay at home. Why? Because everyone says you are pregnant, please don't step outside of your house, you might catch infection. That is very true. Definitely pregnant mothers should avoid stepping out of the house unnecessarily. But definitely being packed in one house for a longer period of duration, that is also one of the factors which results in anxiety and depression. Okay. So now there was a systematic review which was conducted by World Health Organization, which has revealed that pregnant and recently pregnant women who were COVID positive are less likely to be symptomatic and manifest common symptoms as compared to the non-pregnant women of the same reproductive age group. So now, again, the ICMR and WHO, both of the organizations have said that pregnant women are less likely to develop the symptoms as well as become positive or to transfer the symptoms also. In the further slides, we will discuss about the transfer of the infection from the mother to the fetus also. Now, talking about the risk of corona infection in the fetus. Now, how, and to what extent can the fetus be affected? Because obviously, from the mother, every infection gets transmitted. Not every, but I should say almost every infection gets transmitted to the fetus by crossing the placental barrier. That is the first means through which the nutrients passes from the mother to the baby. The what should I say? The byproduct, the waste products from the fetal body gets to the maternal body for the excretion. Right. That is what we have studied in fetal-placental circulation. So, talking about effect of corona infection on fetus, there is first of all no evidence at all for the increased chance of miscarriage. That means there is no study which will prove that because of corona infection any mother got miscarriage. Next is, since we have already discussed in the previous slides that during pregnancy, if a mother catches COVID infection, then definitely there are chances of premature deliveries or preterm deliveries. So now we definitely know that if there's premature delivery or preterm delivery, it might result into low birth weight babies. It might result in certain physiological or physical, physiological or physical effect on the life of the fetus, right? So definitely babies born full term, before full term, that is before 37 weeks, that means the babies who are premature or preterm, they are definitely vulnerable to the problems which are associated with being premature. And as such, there is no symptoms of the COVID being found till date in the newborns which were born positive, which were born to the positive COVID mothers. Next is according to CDC. Now, what is CDC? CDC, I know everyone knows, that is Centers for Disease Control and Prevention, that states that newborns born to the COVID infected mothers have tested to be negative, and the very few who tested to be positive either had very mild symptoms or no symptoms at all and recovered soon. So in my presentation right now, you're going to see everywhere you are going to hear the name WHO, CDC, FOGSI, ICMR, because see, when we try to serve the internet for all these information, there will be lot many websites, there will be lot many areas which are going to tell you, which are going to inform you regarding this. But we need to believe and we need to rely on certain authentic and reliable sources. So I've tried to include all the guidelines, all the protocols which are being generated by such big organizations. Okay. Next is vertical transmission of infection. Now, this is a very important topic over here because whenever pregnancy is concerned, whenever a thought comes of pregnancy, okay, pregnancy, whatever the condition mother is having, there are chances that the fetus might also be affected, right? Okay, so the first thought comes up, you are having a lot of vomiting. So is your fetus okay? Is your baby okay? You are having swelling in your foot. You are having a lot of headache. You are having a lot of stomach pain right now or an abdominal pain. What in the layman language it is said कि पेट में बहुत दर्द हो रहा है, बच्चा घूम तो रहा है ना, बच्चे का movements feel तो हो रहा है. That is the layman language which people ask the mothers questions about, right? Because definitely everyone knows that whatever mother is going through, it is going to affect the fetus through the vertical transmission. Now, again, the ICMR states that till date, that means till today, there is no evidence at all of the presence of COVID virus or coronavirus in the breast milk or the amniotic fluid. That means first step of this vertical transmission is blocked over here. That means there is no evidence. The coronavirus has not been found in the breast milk or the amniotic fluid. Likewise, our UNICEF has also stated that COVID virus has not been found in the vaginal fluid or the cord blood. So now the second step of the vertical transmission is also blocked. That means the cord blood or vaginal fluid have also been found free from corona infection. Okay. Next is mode of delivery and COVID infection. Talking about the mode of delivery and COVID infection is that recently what I have seen is I came to know about various of my known people. One of the pregnant mother whom I know very nicely, and she is very good friend of mine. She was, I guess, 12 weeks or 14 weeks pregnant, and she came out to be COVID positive. The RT-PCR report came out to be COVID positive, and as such, she was having basic symptoms like shortness of breath. She was having decreased saturation in terms of not about 80 or 70. She was having saturation at the level of 92% saturation. And she was so much anxious about the condition of the baby that on her own, they opted for the medical termination of pregnancy. She herself thought that instead of in future affecting my child, instead of having a deformed baby, instead that my baby dies on my own, I don't know why she opted for her, she opted on her own and went for the medical termination of pregnancy, which I would say that was very wrong on her part. Now, I would like to take this platform to encourage all the healthcare professional or any of the non-medico also who is listening to me right now, that if in case you come in contact with any of the pregnant mothers, please encourage them and please inform them that COVID virus or coronavirus is definitely not an indication for medical termination of pregnancy. But yes, if some other comorbidities attached along with the coronavirus, then definitely MTP is one of the option. But after having a proper consultation and discussion with the healthcare provider. Next, now this is also a very what should I say, a very important point which comes up in the minds of every person, that okay, so now up to ye COVID positive ho gayi, ab to iska operation hi hoga. That means now she is COVID positive, she is definitely going to have C-section, because COVID positive hai, to normal delivery is not at all positive, not at all possible. But what the health organizations tell us, that COVID alone is definitely not an indication for cesarean section. Now, so we have finished about talking about one part of our webinar, that states the risk of COVID infection on the pregnant mothers. We also discussed about the risk of infection on the neonates or the fetuses that are born to the COVID positive mothers. Now we are going to come to the next part of our webinar, that is care during pregnancy in case of COVID pandemic. Talking about the care during pregnancy, see, care during pregnancy in case of an infected mother as well as in case of a non-infected mother, both remains almost similar. Only there's a very thin line difference between the infected and the non-infected care. Almost everything remains the same. Okay, so first, as I already said, that the mean incubation period for coronavirus is approximately 5 to 7 days, and people may show symptoms latest by 11 days or 14 days also. So now following information is the must in history taking. Now talking about history taking in pregnant women, whenever pregnant women visits a healthcare facility, being healthcare professionals, we all very well know that what is the history that we're supposed to collect. I guess the first thing that I ask, being a healthcare professional, what I ask to the pregnant mothers is, apart from the name, first of all thing, first I ask is age. What's your age? What was your last menstrual period? What is your past obstetrical history? Are you having some other problems attached with you? Are you having diabetes? Are you having in your family is someone having diabetes? These are the basic questions that we ask to the pregnant mothers, right? Apart from that, now because of the COVID pandemic, it is very important for us being the healthcare professionals to include these points also in our history taking. That is, first is the travel history. We need to be very sure enough. We need to question mothers again and again and take out the information regarding travel history of the mother. Then we should also have information regarding the history of exposure of the mother with the symptoms of COVID. That means we need to know what the symptoms the mother is having, be it very basic like a simple sore throat also. Then also we should be aware about the symptoms that the mothers are having. Next is certain immunocompromised conditions or any other associated comorbidity symptoms. Now, in the previous slides, we have already discussed certain of the comorbidity symptoms associated or the immunocompromised conditions like HBsAg, like HIV, maybe like asthma, certain breathing difficulties also like asthma, like bronchitis, like pneumonia. So these kind of information also, being the healthcare professionals, it is our responsibility to inquire the mother, to question the mother and again and take it up as a history taking. Now, after collecting the history, the next step comes in the complete assessment of a pregnant mother is history taking is the first step. Then is the physical examination. That is what we teach to our students also, and that is what a healthcare professional is supposed to do in the hospital setting, right? So now talking about the clinical presentation of the COVID infection during pregnancy. So it is again very much similar to the general population. That is, first of all, mild to moderate flu-like symptoms of cough. Second, sore throat, fever, difficulty in breathing or shortness of breath. Now, all these are the very common symptoms of COVID positive, of coronavirus, which I definitely know you might have seen in people who came out to be positive. Now, all these symptoms are termed as severe acute respiratory illness or SARI, as given by WHO. So, World Health Organization has given the name as severe acute respiratory illness, and which is including these symptoms. Now, pregnant women who have some medical condition associated with it, they might also develop pneumonia if she has respiratory conditions associated before catching this COVID also, or maybe she might also develop mild hypoxia. Now, talking about the immunocompromised conditions and the elderly pregnant women, as we all know, elderly mothers are definitely a high risk. They are definitely counted in the high risk conditions. Talking about them, they might develop also fatigue. They may also present with malaise, body ache, gastrointestinal symptoms like nausea and diarrhea. And apart from this, the basic clinical manifestation or the presentation remains similar exactly as that of the general population. So these were the common manifestations. Now over here, I would also like to share one more example, very much live. I definitely know one of my senior. She was pregnant, I guess 5 or 6 months. She was 5 or 6 months pregnant, and but the problem associated with her was that she was hepatitis B positive. That means she was having one immunocompromised condition associated with her. That was she was HBsAg or hepatitis B positive. And on top of that, when she got COVID, her RT-PCR report came out to be negative, sorry, positive. Definitely, she was having these many symptoms, which we discussed right now. Apart from this, when one day I was on call with her, I was just asking that, how are you? What is happening? How is your health right now? Are you feeling good about you? So basic questions. I was just having a friendly conversation with her. And what I realized is just after talking for 1 or 2 minutes with me, she became very much restless. She got shallow breathing. She was completely breathless. And I was like, hey, what happened? Are you fine? You please sit down. Don't run and don't rush from here and there. I'll talk to you later. This was the basic concern which I suddenly got. But she told me, Itisha, I'm completely fine. Don't worry. I'm sitting completely good. But it is happening with me that whenever if I'm talking also these days, what is happening that I become very much breathless. I'm not able to stand for a few minutes. I'm not able to talk to people even for 1 or 2 minutes. That means what is, and apart from this, what all she developed, she told me she has now got jaundice also. She's having itching in an entire body and some other manifestations also, which mean that if a mother is who is pregnant and she came out to be COVID positive, apart from this, if she is having certain comorbidities, maybe like an immunocompromised conditions, then definitely the manifestations will be which are going to be shown in her body, or her body is going to present. That is definitely going to depend not just on the coronavirus symptoms, but also upon the underlying conditions. So now there's a picture which I have placed over here. It also reads the symptoms basically. So apart from the symptoms which I said, the basic symptoms of corona like loss of taste and smell, that is also definitely going to be present in pregnant mothers. Okay, now coming to the next aspect, that is testing for COVID-19 in pregnancy. When we talk about COVID-19 in pregnancy, the testing is basically basic test, that is RT-PCR test. Then you might have seen people undergoing CT scan or X-rays. So the same tests are also prescribed for the pregnant mothers. Now, in case of pregnant mothers, RT-PCR is definitely recommended by Indian Council of Medical Research. Now, CDC, that is Centers for Disease Control and Prevention, they recommend a nasopharyngeal swab specimen. Nasopharyngeal swab specimen, usually I have seen in the healthcare facilities these days in my place over here, that at some of the healthcare facilities, when we go for the RT-PCR testing, some of them were taking only the nasopharyngeal swab. While when I went to the another health facility with one of my known person, over there the nasopharyngeal as well as oropharyngeal, both the swab specimens were taken. But CDC says that if it is only nasopharyngeal swab, then also it is completely fine. It's okay if we try to avoid the oropharyngeal swab. Next testing is CT scan or X-ray. So CT scan and X-ray, as we know, it is similar as that of the general population. But when we talk about the pregnant mothers, we have to make it very sure that when a pregnant mother is undergoing any type of radiological testing, be it CT scan, X-ray, or any other radiological testing, then she should be having an abdominal shield to protect the features from the radiations. So this is our responsibility. Being healthcare professionals, it is our responsibility to make sure, because mothers are non-medical, they are non-healthcare professionals. So they might not be aware about these basic harmful effects of these things. They might say, "Arey, kya ho gaya? Only it's 5 minutes ki to baat hai. It's only about a matter of 5 or 10 minutes." But we should be aware. We should encourage the mother ki no, it might affect your fetus. So let's protect the fetus with it. Okay. Then apart from abdominal shield, what is the next important step as the health workers' responsibility is to have an informed consent of the imaging. That means we need to have an informed consent. We need to take a written consent from the mother for these radiological testings. Okay. Now, after these basic testing, that is RT-PCR, CT scan, and X-ray, the other testings depends upon the comorbidities attached. That is basically leukopenia, lymphocytopenia, mild thrombocytopenia, mild elevation of liver enzymes. Okay. So these are the certain manifestations, or I should say certain investigations, which are also being performed, which come out to be certain positive. It might come out because of the infections in the mother. Okay, so till now we have discussed about the risk of COVID during the pregnancy, the basic risk of COVID during the on the fetus. Then we also came across and discussed about the clinical presentations in a pregnant mother in case of immunocompromised condition, in case of certain comorbidities attached. We also discussed about the basic testings which are being performed in case of a pregnant mother. Okay, now here are certain of the I'm sorry if someone's mic is on, and please mute it. I request all the members right now to please put off their mics. Okay, thank you. Now, the next is pointers to be strictly followed by the healthcare providers over here. Now, this slide and the coming one or two slides more are specifically for us, the healthcare providers. First is, if a woman meets criteria for the COVID testing. Now, what was the criteria for COVID testing? If in the initial slides, if you remember, I told you about the history taking. We need to ask about the travel history. We need to ask about the history to the about the exposure to the COVID positive person, or the history of symptoms. We need to basically assess the mother regarding the symptoms and certain medical or the immunocompromised medical conditions associated. So if the mother is having any such criteria for COVID testing, then in that case, she should definitely be tested. And until the test results are available, we have to make sure, being healthcare professionals, it is our responsibility that until the pregnant mother's reports are available, we should treat them as a confirmed COVID-19 case. Next is, now this is again very important for us healthcare professionals, that we should not delay the obstetric management in order to test for COVID-19. See, these days, because of the increasing impact of COVID on the people and the life of every age group, the government and the Ministry of Health and Family Welfare, WHO, everyone has given the protocols that before a person undergoes any type of testing, RT-PCR report is a must. Previously, few days back, I was with one of my family members with the hospital, and the person was supposed to undergo MRI, right? And instead of taking the person, because it was an emergency situation, the hospital strictly stopped me then and there, and they asked me, ma'am, first of all, you bring the RT-PCR report of the patient. So that means because of that RT-PCR report, again, that MRI testing got delayed for the coming 3 days, because definitely RT-PCR report, sometimes it takes a lot of time to come out, right? But so that was still fine because it was an MRI and it was not that emergent, which might be in case of pregnant mothers. So in case of pregnant mothers, we need to be very much sure that we do not have to delay obstetric management. But the second thing is, we cannot go against the protocols also. So we have to make sure that as much as possible, we wear the PPE kits, we make sure that the pregnant mothers also are with their complete infection protocol policies, and they're following the guidelines, and then we provide them basic management. Next is certain elective procedures, certain procedures which are not mandatory right now, which might not be an emergency situation, like the induction of labor or maybe routine growth scans, which is definitely not very much necessary, or the routine investigations, they can be reduced to a minimum, but only after the discretion or discussion with the healthcare provider. Next is, definitely the mothers have to undergo ultrasound testing. So if in case mother undergoes an ultrasound testing, then she has to be, that ultrasound machine has to be decontaminated after use. It is again our responsibility that we need to clean all the instruments, are not just the ultrasound equipments, but apart from this, all the other instruments which have been used on one of the patient, definitely we do it. But it is sometimes it becomes very difficult, well, because I have seen in many of the places in the hospitals, the healthcare professionals, one instrument which was used, because I have seen in the hospital setting, the scissor which was used for the episiotomy cut of one of the patient, one of the pregnant mother while delivery, that same scissor was used for the other mother. So this is where, being healthcare professionals, when we know that something is wrong, sometimes because of our negligence, sometimes because of lack of time, we indulge in these many things. So we need to make sure that we are trying to prevent the infection as much as possible. Next is, when a pregnant mother visits for an antenatal checkup, then she should be examined on priority, and she should be segregated from the routine patients waiting for their appointments. Now, this is again an important aspect, and it is an important responsibility of us that whenever a mother is coming to the hospital for her checkup, we have to make sure that there are different zones. For one, different zone is kept just for the pregnant mother, one zone is kept for the entry of the normal general patients in one of the hospital of my place over here. I've seen the hospital was having two doors, two entry doors, right? So they have clearly written on one door entry only for the pregnant mothers, and on the other door they have written entry for the general population. And they're making sure that only the pregnant mothers enter through that one door, and no other general public comes through that door. So I found it that to be really good and a really innovative step to reduce the transfer of infection. Next is, we need to counsel the mothers that if they test positive for COVID-19 during pregnancy or any time before the delivery, she will have to deliver at a dedicated COVID-19 facility. See, these days what happens now, many of the hospital centers in every of the cities, because of the increasing COVID cases, many of the hospitals have been marked as COVID centers, which are taking only the COVID patients and not any other general patients. In that condition, we need to counsel the mothers before itself, so that she can pre-plan her delivery setting. She can pre-plan or pre-discuss with her obstetrician regarding the delivery place and all such matters. So these were certain points which we, being the healthcare professionals, we have to keep in mind. Okay. Now, next is, see, as it is said that prevention is always better than cure. Definitely, we, being the healthcare professionals, are going to do every means. We are going to opt for preventing the infection we are going to protect the pregnant mothers from getting any type of infection. And that means we are going to provide every managing measure that we can. But over here, FOGSI. Now, what is FOGSI? I hope everyone is knowing. That is Federation of Obstetrics and Gynecological Societies of India. So this FOGSI is stating that the pregnant women can protect themselves by the motto of do the five. Now, what is do the five? Do the five, basically, we can say it is like the 5 fingers in one hand. These are the basic motto which we all know. But pregnant mothers need to remember this. So it is our responsibility to educate them, to inform them. And if any of the pregnant mothers listening to me right now, then please make sure you follow all these steps. So first, thumb, I should say thumb. Thumb stands for home. Home means that the mothers should stay at home as much as possible. She should limit her in-person gatherings. She should go for the virtual antenatal visits as much as possible. That means it is everywhere it is said, no, stay home and stay safe. Please try to remain inside of your houses. Don't step outside if there's no emergency situation or there's no certain conditions when it is compulsory for you to step out. So if in that conditions, when there are avoidable circumstances are there, please try to avoid and stay home as much as possible. Then secondly, please, we need to educate and we need to spread awareness that mothers can plan their baby shower and such other kind of functions and celebrations through video get together also. And there are various modes and various platforms for social media where people can get together through video conferencing calls, and they can limit their in-person gatherings. Because see, prevention, as I said, prevention is always better than cure. Definitely there is, doctors are trying to do their best, nurses are trying to do their best to prevent and to protect the mothers and as well as the general population. But it is in our hands also to prevent ourselves also and protect ourselves also from getting any kind of infection. Next, first finger stands for hands. So hands says, this motto says that FOGSI says that washing hands with soap and water for the 20 seconds should be a mandatory ritual. It should be a mandatory, I should say, ritual and of our families now, right now, of our lives, that we need to wash hands properly with soap and water. But if in case the pregnant women are in certain situations where they cannot wash hands with soap and water, then definitely the alcohol-based hand rub or sanitizer definitely comes for the rescue. Next is elbow. So elbow, third thing that we have read in the newspapers, we have read in the televisions, through the advertisements, we have seen that if the person needs to cough or sneeze, definitely she or he should be using a handkerchief. But if in case a pregnant mother is not having a handkerchief or a tissue paper, then definitely she can make use of her bent elbow. But she has to make sure that the used handkerchief and a used tissue needs to be discarded in a closed bin. After that, if suppose a pregnant mother has sneezed, then we need to educate her that do not use your same hands on your face. Do not touch your eyes. Do not touch your nose. Do not touch your mouth with those same contaminated hands. Why? Because we will, if a pregnant mother is doing the same thing of touching her face, of touching her body parts with those contaminated hands, then definitely the mother is putting herself into more risk of infection. Next is space. Space is definitely, social distancing is a must. In Hindi, it is a saying which is being prevalent everywhere, कि 2 गज की दूरी hai zaruri, right? That is a basic saying which is being everywhere. It is coming out in advertisements. So it is very common that for pregnant mothers, if in case the pregnant mothers, it becomes necessary and compulsory for the mothers to step out of the houses, please make sure that the mothers themselves protect themselves and try to stay away from the public places. Now, why am I emphasizing on these points? This is, you might be thinking that these are all the general information which we need not know again. But the problem is that what I am looking these days is the general public. When I talk about the general public, when they are going outside, they think कि अब तो vaccine लग गया, अब mask पहनने की क्या जरूरत है? So many people think that since they have got vaccinated, they have got a lot of immunity in them. There are a lot of antibodies running inside their body, and once they were tested for once they came out to be COVID positive. So now absolutely there's no need for them to again get what should I say? Again wear mask. And when they're driving, when they're standing beside the road, there's no need to wear mask. What I have seen people doing is they're wearing the mask, but either the mask is on their chin, covering, making a good, their beard cover, I should say, for the males, and for the females, it is a good fashion cover, like such a sort of a thing where the mask is just covering their chin instead of covering their mouth and nose. Now, see, because of such kind of people, we put our lives at risk. So pregnant mothers need to be sure enough that when they step out, do not worry whether the other person is wearing a mask or not. Make sure that you wear the mask. This is for the pregnant mother specifically, and we, the health professionals, we need to advise anyone. It's not just our responsibilities at the hospital. Being the healthcare professional, if we are at our home place also, if we are in our houses also, and if in our nearby or in our family, if someone is pregnant, it is our responsibility to guide them, to encourage them, and to then and there provoke them. Yes, actually, I should use the word provoke them of wearing masks, that they can get infection from a person who is standing beside to them. Okay. So after this, do the 5 motto. Now we are going to start the next aspect of our today's discussion, that is antenatal care. Now, what is antenatal care basically? Now, as we know that the entire gestation of pregnancy is divided into 3 phases. That is antenatal care, intrapartum care, and the postpartum care, right? Antenatal is everything before the delivery of the baby. So now there's a picture which I have placed in front of you right now, which says a flyer which was generated by World Health Organization few days back. It says that quality antenatal care should be available for all the women to ensure a positive pregnancy experience. Now it is written quality antenatal care should be available for all the women. All the women term definitely includes the COVID positive mothers also, and it is including definitely the COVID negative mothers also. So all the women is a broad terminology which is including both the mothers irrespective of their COVID status. That means it is our responsibility to provide them quality antenatal care irrespective of their status. Now, World Health Organization has basically said that every pregnant woman needs to have at least 4 compulsory antenatal visits. This is already said, and we have read it in our textbooks. We teach this to our students also. But because of this COVID pandemic, the WHO is saying that up till 12 weeks of gestation, that means up till first trimester of pregnancy, once the pregnancy is confirmed through an ultrasonography scan, there is absolutely no need for an urgent ANC visit, and the mothers can definitely delay their visits if there is no urgent situation. Next is, if the mothers do not have any significant risk or pregnancy related disorder, that means the mothers are not having hypertension, there is no swelling in her foot, there's no swelling in her face or ankles, then the mother is not having any kind of any other pregnancy related conditions, then in that case they can definitely reschedule their monthly visits. But remember that the mothers can plan it out, but only after discussing it with the healthcare providers. Next is, any women who has a routine appointment delayed for more than 3 weeks, then she needs to be contacted. Now, it is again our responsibility over here. We are the healthcare professionals, and we know how many pregnant mothers are registered in our hospital. And we have to be very much precautious and conscious about it, that if a mother is not coming for the antenatal checkup since past 3 weeks, then we need to contact them and ask them what was the basic reason. Next is that routine antenatal visits and the clarification of doubts. Definitely the basic questions, the basic queries, the mothers need to be encouraged that the basic question, doubts and queries definitely can be sorted out just on the telephone calls or the video conferencing calls. But if many of the obstetricians provide these services right now, many of the doctors, not just obstetrician, but every of the facility are providing, every of the hospital facility is giving this benefit of online conversations, online consultations. But the point which has to be underlined over here is with home blood pressure monitoring. Now, blood pressure monitoring is very important in case of pregnancy. So if the mothers are having a facility or of monitoring their blood pressure at home, then in that condition, they should avoid going to the antenatal visit just for the mere doubts clarification. Next is, in no case, I have written this with red point. This is very important over here. In no case shall the pregnant women visit a facility dedicated for COVID-19 for antenatal checkup. That means in no condition the pregnant mothers should go for the antenatal visits. Now, again, I would like to share one more example with you over here. There's one obstetrician in my place over here. I know her very well. That ma'am, the doctor, what she did, she has her own maternity center, but she goes for the OPD visits into some other hospitals also. Now, looking after the increasing COVID cases in my city over here, she converted her entire maternity center into the COVID center. I'm sorry. She converted her entire maternity center into the COVID center, and everywhere there were boardings, there were hoardings that this particular maternity center is now taking only COVID patients, and all the pregnant mothers should not come to this center, but instead they should go to the other hospital for the OPD checkup if they want to refer to this particular doctor so and so. That means I found that to be a very good initiative by that madam. I'm sorry again, please put up your mics. It's really disturbing. I'm sorry. Okay, thank you so much. Okay, so it was a really good and innovative initiative taken up by that ma'am. So being a healthcare professionals, we can also take up such steps and we can prevent the pregnant women from visiting the COVID centers for their basic antenatal checkups. Next is, women need to be advised to note their fetal movements every day. Fetal movements needs to be noted every day. Not just fetal movements. Apart from this, it is our responsibility to teach the pregnant women also about certain other warning signs. Warning signs, be it like bleeding, be it like leaking from the vagina, bleeding from the vagina, sudden swelling on the foot, sudden blurry vision or puffiness around the eyes, tightening of the finger ring. These are the basic manifestations, basic warning signs that we have studied and what we know, right? What we have seen in practical settings also. So whenever a mother comes to us in the hospital, especially during this COVID cases, we need to advise the mother regarding all these things. And specifically, we need to teach the mother about how to count and monitor the fetal movements. Why? Because the mothers are going to be, for maximum period of time, they're going to be at home. So when they're at home, self-monitoring of the fetus is also very necessary. Next is, essential milestones such as 12th and 19th week scans are definitely needed. WHO says 12th and 19th weeks growth scans for the fetal surveillance is very much necessary. Next is for women who are self-quarantined because someone in their household had possible symptoms of COVID-19, appointments should be deferred for 14 days. Now, World Health Organization has given this guideline that if in case a pregnant mother has self-quarantined herself because someone in her family was positive, then in that condition, her antenatal visits can be postponed for the coming 14 days. But if in case the pregnant mother herself had the symptoms, that means I have written over here, if pregnant mother herself had the symptoms, then in that condition, the mother can defer the antenatal visits for the coming 7 days. 7 days, why is it that earlier it was 14 days and now it is just the 7 days? Because if the mother herself is having symptoms, then in that condition, it is very important to assess the mother for the severity of the symptoms. It is very important to find out whether the fetus is affected or not, or how much or to what extent is the infection affecting the fetus and the mother's condition. So it is very important for us to make sure that the mother, that right after 7 days, the mother visits the facility for the checkup. I'm sorry, someone is writing on the screen or what? Something is happening, please. Okay. Thank you. One more line is there, which is making my slide more attractive. So thank you so much. Okay, next is, if a pregnant woman is having certain flu-like symptoms that we have already discussed, that during COVID, the mothers can have flu-like symptoms like sore throat, cough, cold, fever. Then in that condition, if a mother is having such symptoms, and on top of that, she tests out to be COVID negative, and there was no obstetrical intervention required. In that condition, she can home quarantine herself till the symptoms get resolved. Next is, if a previously pregnant woman tests to be negative with COVID-19, that means previously the mother was having symptoms, but she came out to be negative, and those symptoms reappear. In that condition, she should be treated as a COVID suspect, and she should be tested for the COVID-19 again. So that means these are the basic things we need to remember. Okay, now this is again something very important, which is given again by Federation of Obstetrics and Gynecological Societies in India, that is FOGSI. They have given a triaging system, right? We have studied about the triaging system in which we triage the patients in the emergency department of the hospital. Remember something about triage we have studied, and we know about it, and we practice in our hospitals. Likewise, in for pregnant mothers also, specifically during this COVID pandemic, FOGSI has given certain triaging system in which they have divided the pregnant mothers into three different zones. As you can see over here, I've written. First is the infected zone, second is the potentially infected zone, and third is the clean zone. So infected zone is going to include mother. I'm really sorry, but someone is trying to make my slides more attractive. Please don't do that. I would like a very simple slide then instead of these creativities. Please stop it. Next is infected. So again, as I was talking about, infected zone, potentially infected zone, and the clean zone. So infected zone will include the mothers who tested and they came out to be COVID positive. So definitely they are the infected zone. Now potentially infected zone are the mothers who have the symptoms of SARI. Now what was SARI? SARI is severe acute respiratory illness. And what were the symptoms of SARI? They were basically flu-like symptoms along with loss of taste, loss of sense, and the other symptoms which might appear because of medical conditions or the immunocompromised conditions. And the mother has a history of contact with the infected individual, when the mother has a history of travel history within the past 14 days. If in case the mother herself is a healthcare worker who was taking care of the COVID-19 infected individuals and the test results are awaited, then in that condition, mother needs to be kept in a zone that is known as potentially infected. Clean zone, from the name itself says clean, matlab koi symptoms nahi hai. That means no symptoms at all of SARI, no contact with the infected individual, and no travel history. So these are the three zones which we healthcare professionals, which we can also use in our hospital settings to categorize the mother into three different areas. Okay, next is, now depending upon this, the infected and potentially infected women should be kept in the separate isolation area. That means there should be separate isolation departments for segregating or for keeping the infected and potentially infected mothers separately, because definitely they are at a verge of spreading the infection, and these isolation areas should have definite isolation wards and isolation ICUs separately for them. Next is, access to these isolation areas should be strictly limited. It is our responsibility to make sure that we are limiting the access, be it the family members also. We should limit the nursing care, we should limit the love and affection which the family members want to give to their pregnant wife or a pregnant daughter or someone. Next is, family visits and the nursing care should be definitely declined. Only the telephonic conversations should be allowed between the pregnant mother and the family members, just for the sake of reason of preventing the cross infection from the mother to the family members, and to protect the mother from any more harmful effects of infection. So this was all about the segregation of pregnant mother into infected, potentially infected, and clean zones. Now after this, okay. So after, I'm sorry, over here. Okay. Just give me 1 second. Okay. Now after this, we move on to this slide over here, which I have placed in front of you. I hope it is visible to everyone right now. This chart, this management chart, was actually given by Lancet. So I have adopted this chart. I've taken this chart from Lancet. The first step it is written, or the first sentence in this it is written, is management of pregnant mothers of COVID positive mothers, right? So when we talk about the management of COVID positive mothers, we need to make sure of the various things. So Lancet has very clearly shown this through this flowchart. I've seen this flowchart in many other conferences and workshops also. So the first thing is history taking, but obviously we need to assess again, collect the full entire history, which we have already discussed. Then we need to go through the clinical examination of the mother, which also we have discussed. After the clinical examination, we can also have the RT-PCR testing of the mother. Based on that RT-PCR testing, we will now we have done the RT-PCR testing. Now we are waiting for the result. Now, while we are waiting for those results, we can assess whether the mother is symptomatic or whether the mother is asymptomatic. In conditions when the mother is asymptomatic and she's having no symptoms at all, then in that conditions, we need to monitor the mother at home. The mother can be monitored at home, and there's absolutely no need for the pregnant women to stay in isolation or to be in separate isolation areas. But the asymptomatic mothers can definitely be monitored at home. Now, while being monitored at home, now the RT-PCR report has come out. So now the RT-PCR report will either come to be negative or it is going to become as positive. If in case the report comes out to be negative, in that condition, we need to stop monitoring. There's absolutely no need. Report is also negative. The mother is also not having any such symptoms. So as such, COVID management finishes over here. If in case the test report comes out to be positive, in that condition, definitely, but the mother is asymptomatic. Mother is having no symptoms, but the report comes out to be positive. In that condition, the pregnant women can be isolated at home for the next 14 days. And during those 14 days, the proper maternal surveillance and the fetal surveillance regarding the monitoring of the fetal movements should be done properly. Now, if during this 14 days of period, the delivery is expected in the mothers, then in that condition, the delivery can be performed easily. And again, the mode of delivery is definitely not depending on the COVID status alone. It is also depending upon the maternal health and fetal health conditions also. Now, if in case the mother comes out to be symptomatic, earlier we talked about the mother was asymptomatic, there was no symptoms at all. Now we're talking about if in case the mother is symptomatic, she is showing symptoms like fever more than 30 degrees centigrade and certain respiratory symptoms, which we have already discussed. In that condition, we have to make sure that the mother gets admitted in the hospital. She needs to be monitored in the hospital. Then in that condition, mother should be kept in isolated areas. Certain protective gears like masks, like gloves and gowns should be worn by the mother as well as by the healthcare provider who is going to take care of the mother. Now, during this period, again, if the delivery is being expected, then again the delivery room should be separate and separate neonatal table should be separate. Now, likewise, the mother was having symptoms and we were waiting for the COVID test report. If in case the COVID test report will either be negative or it is going to be positive. If in case the COVID test report comes out to be negative, then definitely mother can be discharged from the hospital, but she should be isolated at home for 14 days. Now, see, there's a difference between isolation and quarantine, right? So in that condition, if the mother is symptomatic, then she needs to be isolated for 14 days, but clinical self-monitoring has to be done. If in case the test result comes out to be positive. So now because of the positive test result, mother needs an hospitalization in the tertiary care center. Now, when the mother gets admitted in the tertiary care center, proper, specific, strict maternal surveillance and strict fetal surveillance is necessary. Talking about maternal surveillance, then strictly monitoring the vital signs, that is temperature, pulse, respiration, blood pressure 3 to 4 times per day should be need to be performed. Then chest imaging and the other radiological testing can be done. But remember, along with the abdominal shield. Next is fetal surveillance. Fetus also needs to be monitored through its FHR, that is fetal heart rate, needs to be monitored at least once in a day. Next is if in case the pregnancy is a premature, not premature stage, the mother is at a premature stage right now, then that condition, injection betamethasone can also be administered for the lung maturation if the delivery is expected. Now we are going to talk about the intensive care unit admission. The mother might also see admission in the hospital is a separate thing and admission in the ICU or intensive care unit is a separate thing. Intensive care unit means that the mother is severely ill, and the mother is ill to such a state that she cannot be managed in simple wards. So she needs the ICU care. Now, if in case the mother gets admitted in an ICU, so what is the criteria for being admitted in ICU? Now we are going to discuss that. So talking about the criteria for getting admitted in the ICU, first is respiratory rate should be more than 30 breaths per minute. In case the maternal breath rate is coming out to be more than 30 breaths per minute. If in case the oxygen saturation is less than 93% at rest, that means and the arterial partial pressure or the oxygen concentration is coming out to be less than 300 mmHg. Next is patients are with more than 50% lesion progression within 24 to 48 hours in lung imaging. And the main criteria for the admission in the intensive care unit is, it is quick sequential organ failure assessment score, that is QSOFA score. So these were the basic criteria. In the next slide, I'm going to teach and we are going to discuss about the quick SOFA score. So now what is quick SOFA score or the quick sequential organ failure score? So this quick SOFA score is basically an assessment tool which is required for the sepsis or screening in the triage. So now there are 3 criteria which are basically followed in case of quick SOFA score. The 3 criteria are, first of all, the respiratory rate. If it is more than 22 breaths per minute, then in that condition, 1 score will be given. Then talking about the mental status, if the Glasgow Coma scale is less than 14, then again 1 score will be given. If the systolic blood pressure is again coming out to be less than 100 mm of Hg, then again one score. So that means it is a 3-point scale or a 3-point score. So now if in case the quick SOFA score is more than 2 or 2, then that means it is suggestive of sepsis and needs an intensive care unit. So that means we right now discuss that management chart which was given by Lancet. After that management chart, now we are going to we have discussed this quick SOFA score, which is clearly stating if the quick SOFA score is coming to be 2 or more than 2, in that condition, the mother needs ICU care. Now, the basic supportive therapy during the maternal admission in the ICU is very much common and similar as we practice in a hospital setting. It is not much any differences there. The proper rest should be given. Since her oxygen saturation is less, we need to give oxygen supplementation, fluid management, nutritional care. And since we are talking about pregnant mothers, so it is already said that the pregnant mothers should definitely be lying in a left lateral position so that the oxygen supply is more. So that is also needs to be performed. Okay, so till now we have discussed about the antenatal care. We started from the risk of risk of COVID infection during pregnancy, then risk for COVID infection during fetus, and then we discussed about the basic guidelines. Then we discussed about the antenatal care. Now we have stepped into the intrapartum care. Talking about the intrapartum care, the first guideline or the first protocol which the World Health Organization states that maternity care providers should continue to provide client-centered, respectful, skilled care and support. That means every mother, irrespective of her COVID status, she should be given client-centered and respectful care. And while caring, all the healthcare workers should be mindful of adequate protective cares. Then the birth attendant should be limited to one name contact. That means only one named person should be there. See, WHO always promotes birth companion, right? And even in case of COVID pandemic, also WHO is promoting one of the birth companion, but that birth companion also should be COVID negative. Next is adequate counseling should be given to the mother about infection. Next is there should be a separate delivery room and operation theaters for the management of confirmed and suspected cases of COVID-19. Next is the neonatal resuscitation corners should be at least at a distance of 2 meters from the delivery table. But obviously, there is no chances of traveling of infection from the mother to the body through cord blood or through vaginal fluid. But still, there are chances that the baby might get affected because of the respiratory exposure with the mother. So in that condition, it should be away from the delivery table. Next is COVID alone is definitely not an indication of. So COVID alone is definitely not an indication of what? We're going to discuss it is not an indication for the time of delivery. Time of delivery, whether we need to deliver the baby at 28 weeks, 32 weeks, 34 weeks, 37 weeks, or 40 weeks, it is going to definitely depend on the maternal and fetal condition along with the COVID condition. Next is it is not an indication for the induction of labor or delivery. And as I already said, it is not an indication for cesarean section. The exception over here is that the exception is critically ill pregnant women whose delivery may be indicated to relieve the extra metabolic or pulmonary load. That means if in case the mother is critically ill, she is having severe symptoms, she is COVID positive, then in that condition, just to reduce down any kind of load on her lungs, then in that condition, we can deliver the mother. Now, when I was thinking about this COVID status, then in that condition, talking about this delayed cord clamping. Delayed cord clamping is another thing which I was really skeptical that can we perform delayed cord clamping in case of COVID positive status of the mother. Then definitely World Health Organization again states that delayed umbilical cord clamping definitely is highly recommended because the risk of transmission is very much minimal. Next comes is labor monitoring. So labor monitoring should include the maternal and the fetal assessment with the partograph. I have clearly mentioned maternal and fetal assessment with the partograph. Why? Because see, this is a very general statement. So you might be thinking, why? What was the need over here to mention? See, because in many hospitals, which I have seen is right now also in many hospitals, partograph is being not followed. Many healthcare professionals are not giving due importance to the partograph. So I take this platform and opportunity to encourage all the healthcare professionals who are listening to me right now to please encourage your fellow professionals to make use of this partograph. It is a very much mandatory and a very much useful assessment tool, I would say, for monitoring the maternal and fetal conditions. Next is periodic evaluation should be there of the mother, specifically for the shortness of breath. Pulse rate needs to be monitored. Then oxygen saturation has to be more than 94%. Then if there's any such deterioration, then the mother needs to be get admitted in the ICU, as we have already discussed. Next is continuous electronic fetal monitoring in the labor for the women for COVID-19 infection is very important. When the mother is COVID positive, then in that condition, particularly and continuously, we need to monitor the fetal conditions. The second stage of labor should be cut short to prevent maternal exhaustion and reducing maternal effects. See, usually what the WHO says is second stage of labor, we should not induce the labor unnecessarily. WHO says that we should not opt for pharmacological measures for reducing the second stage of labor. Instead of that, we should opt for certain non-pharmacological measures. So definitely, yes, even case of COVID status, the what should I say? No, certain non-pharmacological measures can be opted. But if in case the mother is severely having certain infections, certain symptoms, then in that condition, certain measures can be opted to reduce the maternal exhaustion and maternal efforts. Now comes the epidural analgesia or the spinal analgesia. So when we talk about epidural or spinal analgesia, it is not at all contraindicated in the presence of coronavirus infection. So this means that if a mother is COVID positive, then also she can take this epidural or spinal analgesia. Next is if in case the mother requires a cesarean delivery, then the same epidural or spinal analgesia will be continued and the general anesthesia can be avoided. If a woman who has not had if a woman who has not had an epidural anesthesia and she requires a cesarean birth, in that case, the choice of anesthesia is definitely governed by the general health status of the women. So again, the same point comes out with different words. Again, the same point is coming up that COVID status is not alone is not an indication for any of the obstetrical interventions. Next, so we have finished with the antenatal care. We have discussed about the intrapartum care. I hope I made myself clear to everyone. Next comes is the postpartum care. So talking about the postpartum care, first is continued medical evaluation for the respiratory status and symptoms. Now see, the mother was COVID positive. She was admitted in the hospital setting. So she's still there in the postnatal period. Also, she's there with us in the hospital. In that condition, proper continued medical evaluation needs to be given to the mother for the respiratory status and symptoms. We need to encourage the mother to maintain the good practices of hygiene. Hygiene in terms of personal hygiene, definitely yes. But hygiene in terms of respiratory hygiene, hygiene in terms of hand washing, hygiene in terms of wearing a mask, hygiene in terms of using a hand sanitizer, hygiene in terms even of maintaining social distancing, which is a very must. Next is advice should include management of the engorged breast when feeding has not been established and measures to enhance the breastfeeding after the isolation period is completed. See, sometimes what might happen, no, that mother and baby might be separated because of the maternal severe illness. So if in case the mother is separated, there are chances that the breast might become engorged because of the excessive breast milk which is present there. So in the postpartum period, we need to advise and we need to manage the mother regarding the feeding specifically. So in the coming slides, we are going to discuss about this breastfeeding and rooming it also. Okay, next is birth doses to be continued uninterrupted as these beneficiaries, since they are already in the hospital. So definitely entire postnatal birth doses should be given without any delay. Of course, the iron folic acid tablets and the calcium tablets should also be given again as the postnatal care as that of the general population. This is exactly same. Next is the mothers who had severe illness or who are not able to take care of the baby. They might be isolated from the infants and they might be at the risk of developing anxiety, postpartum depression, or any other maternal health issue or the mental health issue. So if in case the mother was separated from the newborn because of her ill health or maybe because of the ill health of the infant, then that condition she might develop postpartum anxiety. So see, in the beginning, I guess in first or second slide, we have already discussed that there are chances of prenatal anxiety, there are chances of prenatal depression. Likewise, there are also chances of postnatal anxiety, postnatal depression, and the mental health issues, which can easily be rectified through counseling and psychological support, which is very much mandatory. See, we are already aware about the postpartum psychological complications in the postpartum period, right? Even in the non-infected conditions, mothers are at a risk of developing postnatal anxieties and depressions, and we definitely know the reasons for that. Likewise, now since it is COVID positive, since it is an infected case, so in that condition, it becomes more chances, there are more chances for a mother to get all such psychological issues. In that condition, again, the interventions can be provided by virtual consultations or by remote electronic media. So there's no need, if in case the anxiety is mild, the depression is not that, has not progressed to a very severe stage, then in that condition, the mother, after the consultation or discussion with the healthcare provider, she can easily go to the virtual consultations through the electronic media. Next is recommendations given by World Health Organization in pregnancy during COVID. So here I would like to walk with me through the guidelines or recommendations which are given by WHO, especially for pregnancy. So first is, all the pregnant mothers with a history of contact with a person with confirmed COVID-19 case should be carefully monitored, considering the asymptomatic transmission of COVID-19. So this I have already explained earlier. Next is, every pregnant or recently pregnant women with suspected or confirmed mild COVID-19 may not require acute care in the hospital. That means if a mother is having mild conditions or mild COVID case, she might not require an admission in the hospital unless there is a concern for the rapid deterioration, but isolation can be done. So definitely, when we were reading about that chart which was given by Lancet, if you remember, in that we studied very carefully that if the symptoms were mild or if the symptoms were asymptomatic, there was at all no need for the mother to be hospitalized. Instead, only basic isolation or quarantine at home was the basic remedy which was adopted. Next is, here I have placed one of the flyer again published by World Health Organization. This flyer says that all the women have the right to a safe and positive childbirth experience, whether or not they have a confirmed COVID-19 infection. That means this is another recommendation which is given by World Health Organization, that the safe and positive childbirth experience is a right of a mother, irrespective of their COVID status. So that means we are the healthcare professionals. We are going to care for the mothers, whether they are COVID positive or whether they are not COVID positive. So we should encourage the others also to provide them dignified care. We should provide them respectful care. Then the sub points which are written on this chart are, as you can read over here, respect and dignity, a companion of choice, clear communication by maternity staff, pain relief strategies, and mobility in labor wherever possible, and the birth position of choice. So now, again, this point I would like to bring to your notice over here, birth position of choice. See, World Health Organization has previously already recommended about different birthing positions. If we will if we will discuss about the different birthing positions, then World Health Organization has already given a lot of said, and lot of guidelines have come out, in which WHO is recommending that the mothers can choose any kind of position for their labor also, as well as for their birthing time also. Now, that is what same WHO says, even in case of COVID pandemic, that the mothers can opt any position and they should be allowed for that. Next guideline, which the World Health Organization states, that pregnant and recently pregnant women with moderate or severe COVID-19 require acute care. So now, in the previous slide, we were reading that the pregnant or recently pregnant mothers with mild symptoms do not require acute care in the hospital, but a mother who is having moderate or severe symptoms, she definitely requires acute care in the hospital. Next is, again, mode of birth should be based on the obstetrical indications and the women's preferences, and not on the COVID-19 positive infection. So that this we have already discussed a lot about it. So I'll just quickly go ahead. Pregnant and recently pregnant women who have recovered from COVID-19 and been released from the COVID-19 care pathway should be enabled and encouraged to receive routine antenatal, postpartum, or post-abortion care as appropriate. Additional care should be provided if there are any complications. That means the pregnant mothers who have just recovered from the COVID-19 conditions. In that condition, mothers definitely should be given their routine antenatal care, routine postpartum care, or the routine post-abortion care as okay. So till here we have finished about the antepartum care, intrapartum care, and the postpartum care. Now comes the biggest question of this 1.5 year period. That is, can COVID positive mothers continue breastfeeding? Please give me 1 second. I just need to wet my throat. I'm sorry. Now, this is the biggest question again. As I was saying, this is the biggest question till date. That is, can COVID positive mothers continue breastfeeding? So now the question is that, can they do it? See, before discussing about this question, I would like to again share one live example with you. I have a very close friend of mine. She herself is a healthcare professional, but right now she is not practicing in any of the hospital as she's on maternity leave. So recently, few weeks back, she caught COVID, and she was COVID positive. So now she was very much worried that whether she can she breastfeed her baby even in that condition. Though she was wearing a mask continuously even at home, she was quarantined at home. She was not at all hospitalized, but still she was very much afraid, concerned, and worried about this condition. Being a healthcare professional, so since she's my very good friend, so we discuss everything. So she told me that Itisha, this is happening. What should I do? So obviously I knew the answer for this, but still, again, I wanted to cross check before giving any advice to any pregnant mother. Though she was a healthcare professional, but still, when she was asking a question to me, I did not consider her to be a healthcare professional. I considered her she's a lactating mother who is having certain doubt. So when I was wanting to answer her, I just told her, wait for some time. Let me go through the guidelines which are given, and then we'll come back to the same question. So when I went through the different guidelines and when I had a talk with some of the obstetricians also, they also gave me the same answer which I wanted to give to this to my friend. So now let's discuss about this question. But before discussing about this question, let me revise with you the benefits which the breast milk has on the baby. So the benefits which the breast milk has on the baby are, first of all, breast milk definitely provides protection against infection. Breast milk is a very good source of nutrition for the baby. Breast milk is very much effective against the infectious diseases. Breast milk strengthens the immune system by transferring the antibodies from the mother to the baby. Breast milk definitely promotes the bonding between the mother and the baby. So this is not much to be explained. I'm not explaining, but I just wanted you to have a quick recall of the benefits of breast milk for the baby. Looking after becoming aware of all these benefits of the breast milk, this is what World Health Organization has to say to us. There's a chart which I have placed over here again, as given by World Health Organization. It says that women with COVID-19 can breastfeed if they wish to do so. That means the mothers who are COVID positive, they can definitely breastfeed their baby. It is completely an individualized choice. So what is the point which I have written over here? That breastfeeding is completely a matter of individual choice, but COVID-19 is not a contraindication for breastfeeding. Next is, World Health Organization recommend that mothers with suspected or confirmed COVID-19 should be encouraged to initiate or continue the breastfeeding. Okay. That means COVID-19's World Health Organization says that all the suspected and confirmed mothers should be encouraged to initiate or continue breastfeeding. So now it is not just for the mothers, it is for us also, being the healthcare professionals. It is our responsibility to encourage the mothers whomsoever we come across, to encourage our fellow professionals also, that they should encourage their patients to breastfeed their baby irrespective of the COVID status. Okay, I'm sorry, there's some problem, I guess. I'm not okay. Okay, so now there's one, now I want to say what the UNICEF wants to tell us. So UNICEF states the 3 W's for the suspected and confirmed COVID-19 mothers for breastfeeding their baby. So now UNICEF has stated 3 W's. I'm sorry. The 3 W, the first W stands for wearing a mask during feeding. Second W stands for washing hands with soap and water before and after touching the baby. Third W stands for wipe and disinfect the surfaces regularly. So these are the 3 W's which are given by UNICEF for the breastfeeding mothers because of COVID status. So what are they? First, wearing a mask, washing hands, and wipe and disinfect. So now there's a picture which I have placed here, down here. You can see clearly, I guess. Oh, I'm really sorry. This says take precautions when breastfeeding day and night. So as you can see, there's a mother over here who is breastfeeding her baby. And since the background is completely white, so I guess it is the daytime picture it is. So that means the mother is completely breastfeeding her baby, but after wearing a mask. Likewise, there's another picture in which the mother is lying down and breastfeeding her baby when again she is wearing a mask. So I am not saying that the mothers who are COVID positive for 24 hours, they are supposed to wear masks. No, definitely no, they shouldn't wear actually. But I am saying that when the mothers are breastfeeding their baby, or when the mothers are close contact with the baby and they are COVID positive, during that period, they strictly have to wear the mask. Next is current practice for infants born to mothers with COVID. Now, this is another chart which was given by World Health Organization for the management practices of infants which are born to the mothers. So mothers who are COVID positive, again, we have to see whether the mothers are asymptomatic or they are having minor symptoms or they are critically ill. So if in case the mother is critically ill, she is severely ill and she's not at all able to care for her baby, in that condition, we can separate the mother and the newborn, but express breast milk should be encouraged. So again, it is said that the express breast milk, it is very much important. Nowhere in this chart WHO is encouraging for the formula milk or for the pacifiers, for the teats. Nowhere it is written, but it is written express breast milk should be encouraged. Now, if in case the mother is non-severe, mother is not having any severe symptoms, she is completely asymptomatic and she is definitely able to care for her baby, then the World Health Organization says mother and the newborn room in together with infection control practices. That means the mother and the baby can be kept together, the breastfeeding can be practiced, even the skin to skin can be practiced, but with the practices like mask, like hand hygiene, like the distance between that is the distancing between episodes of care. Okay. If I'll read that additional care or the health education written down there, then the important point which is mentioned over here is do not cover the infant's mouth or face with a or nose, as it might result to infant death syndrome. Then it is written COVID positive. The babies of COVID positive mothers can also be cared by the family members, but we have to make sure that we are not making the care of a baby done by some older person or the medically vulnerable person. Again, the home visitation should be limited. Okay. So after this chart, we move on to this. When mother is unable to breastfeed her baby. So when the mother is completely unable to directly breastfeed her baby, in that condition, what does the ICMR say? So the Indian Council of Medical Research has stated that when the mothers are not able to breastfeed or that means they are suspected of COVID or confirmed COVID-19 cases, in that cases, they should either manually express the breast milk or they can make use of the breast pump also to express the breast milk, and as such, which can be provided by the healthcare providers or the family members to the baby. So that means ICMR is also not saying that the mother is ill, so please give the formula milk. No, it is nowhere written. But it is written that the mother should express the breast milk manually or the breast pump. See, formula milk is another condition which, yes, definitely I'm not saying, I'm completely not against the formula milk. Definitely it is, there are certain conditions where formula milk also becomes mandatory to be given to the babies, but that depends that you also know that there are different conditions and indications for those things. Now here is a picture which says how to hand express breast milk and cup feed. So I'm not going to teach you how to express the breast milk because this is a separate topic which can be discussed later. But what I wanted your attention to get focused on, if you can see, there's a small picture in this big chart, there's a small photo over here where there's a red colored mug is there and a person is washing hands with water flowing down, right? That means the mother or a person, that means of course the mother needs to wash her hands specifically with soap and water before expressing the breast milk. Now you can see the second picture over here. The mother is expressing the breast milk. First, she might have washed the hands. As you can see, there are two arrows. So the first arrow is saying after washing the hands, she is massaging the breast to express the breast milk. And in the second picture, the arrow again is there. So the second picture is indicating that the mother is expressing the breast milk. But in this, both the pictures on your left hand side, you can clearly see that the mother was, oops, I'm really sorry, that the mother was wearing a mask, right? So that means again, the second important point coming over here is after hand washing is wearing a mask is again a second aspect. Now you can see the third arrow which is pointing over here, which says covering the expressed breast milk with a lid. That means the breast milk should be kept, it can be stored. Definitely there are different storage guidelines for the breast milk which the World Health Organization has given out, and it should be kept covered. Next is, now you can see another arrow which is coming out over here on the right hand side, which you can see after hand washing, there is someone else who is breastfeeding a baby either through the spoon or through the cup. I guess it is a picture of a husband. We can assume the picture of a father or any other person in the family who are breastfeeding this express breast milk. Now in that case also you can make out that the picture is saying that first of all the mother needs to mother or that family member needs to wash the hands. Secondly, after washing hands, both of the persons are wearing masks. So that means washing hands and wearing mask is not mandatory only for the mother, but it is even compulsory and mandatory for the family members and the caregivers who are caring for the baby. Okay. So here are certain points that needs to be marked and needs to be clearly remembered. First is perform hand washing and wear proper mask before expressing the breast milk. Clean the nipples properly. Now, it is very much important for the mothers that whenever they are expressing the breast milk, not just expressing, when they are about to feed their baby, then also before giving the breastfeed, they should clean their nipples. Next is express the milk either manually or with the help of breast pump. Be careful about cleaning and hygiene of the breast milk. Now, this is also very much important to clean the breast pump before using. Next is do not share the breast pump. Now, this is the point which actually I should have highlighted. I forgot to highlight it. Do not share the breast pump. That means sometimes what happens, no, oh, you're my very good friend. We share our dresses, so let's share our breast pump also. Please do not do that. Howsoever good friend she is of yours, howsoever good sister she is of yours, please do not share your breast pumps. Next is ask the non-infected healthcare provider or the family member to feed the baby with a cup and a spoon. Make sure that the person feeding the baby also follows the protocols of hand washing and wearing a mask, as I've already shown in the previous slide and a picture. Now, so we have discussed when the mothers are not able to directly breastfeed, then what they can do. But now the condition comes is when the mother is too ill even to express the breast milk. That means when the mothers are not able to express their breast milk, then in that condition, approach of wet nursing can be adopted. Now, apart from wet nursing, donor human milk is yet another option. So now, what is wet nursing? I hope everyone is aware of wet nursing. Wet nursing is basically a procedure, I should say, or not a procedure, but it is something in which some other mother breastfeeds our baby. That means some other woman is going to breastfeed, then that is wet nursing. Donor human milk, like there are a lot of blood banks available. So likewise, there are human milk banks also. So that is also another option, depending upon the cultural and traditional and beliefs of the mother and the family. Now, when I was trying to read about all these things on the internet, I came across with this wonderful quote or a flyer, which I have written over here, which says, breast milk is love turned into food. Breast milk is love turned into food. It takes someone special to share that love. So I really love this quote, which says that breast milk is definitely love turned into food. So I would like to encourage every one of you to please encourage all the mothers that they need to become that special person of sharing that breast milk to the other baby, so that you can be a special person for that special newborn. Okay. Next is, so the question comes again that can COVID positive mothers breastfeed during the pandemic? So answer to this is definitely yes, they can. So here I would like to quote Annie Spangler over here, who says that while breastfeeding may not seem the right choice for every parent, but it is the best choice for every baby. So I take this platform to encourage everyone over here that do not let COVID stop you from giving the best to your baby. Okay. Now, coming to the almost last section, I know you might be tired of hearing me, or I guess I might be boring also sometimes, but please bear with me for a few more minutes. So till now, we have discussed about the risk of corona on pregnant mothers, on features, then we discussed about the clinical presentations, we discussed about the investigation, then we came across the antenatal guidelines, intrapartum guidelines, postpartum guidelines, then breastfeeding. Now comes another question, that is newborn care during COVID pandemic. So WHO, that is World Health Organization, recommends that if your baby is less than 2 years in age, neither put a mask nor a face shield on your baby, which we have already discussed that there's not at all, there's a need to put a face mask or a shield on a baby. Next is rooming in and skin to skin contact. So now you can see there are two pictures which I have placed down there. It might be visible on your screen. That means the mother is wearing a mask, but apart from wearing a mask, she's also having the baby right on her chest, which makes it very clear that rooming in and skin to skin is definitely allowed and recommended by the COVID positive mothers. The only criteria when rooming in is not done is the condition when the mothers are severely ill, which we have already discussed. I need not go back to there. So World Health Organization advises that the mothers should continue to share a room with their babies from birth and be able to breastfeed and practice skin to skin contact. Okay, so there's this flyer which I took out from the World Health Organization website. So it says close contact and early exclusive breastfeeding helps a baby to thrive. Definitely, as we know that kangaroo mother care or skin to skin care when given by the mother or any other healthcare provider, it definitely improves the thermoregulation of the baby. Obviously reduces the morbidity and mortality rate. It obviously improves the maternal and the the infant bonding. So which should be practiced and encouraged even in times of COVID pandemic. A woman with COVID-19 should be supported to breastfeed safely, hold her newborn skin to skin, and share a room with her baby. So this is very much important. Okay, so here are certain tips, which is for the newborn baby care tips during the COVID-19. So what are the tips? First is hand washing. So hand washing is definitely a must. You can see there's water, there is soap, which is mandatory. I should say it is a mandatory ritual, which is not just for the pregnant mothers, but whosoever is listening right now also should make sure that they practice hand washing. Next is respiratory hygiene. Again, you can see respiratory hygiene is very important. You can see there's a picture of a mother who's holding the baby very close to her, but she is wearing a mask. Next is no mask for the babies. As I already mentioned in the previous slides, WHO is also recommending the same thing. ICMR also recommends the same thing. There's that you should not put a mask on your baby who is less than 2 years of age. The reason for that is that the babies this practice of yours might result in sudden infant death syndrome. Next is social distancing, but obviously I'm saying it since the beginning of my presentation. It is a must. Breastfeeding and STS, that means breastfeeding and skin to skin contact should be encouraged, should be promoted by every one of us. Next is stop, no visitors, please limit the visitor. That means it is mentioned everywhere. Please limit the visitors at your place. Okay. So here we have finished with the basic healthcare tips. When we're talking about the stopping the visitors, it is not just only during the pregnancy condition, but it is even during the condition when your baby is born, you have brought the baby to your place, and obviously everyone will be very much excited to have a first look of your baby, or to meet the newborn baby, to play with the newborn. But I encourage all of you that please make sure that during this, since it is COVID pandemic, please make sure that you have all of this celebration, all of this first look visits through your online conference calls, or through your video calls. Okay, next is, and the last aspect over here is COVID vaccination is recommended for breastfeeding and lactating women. So this was also a very big question, which is right now everywhere. You can see the government of India, Ministry of India is trying hard to provide vaccination for every age group. Right now, the trial is going on for the COVID vaccination for children. Still, the COVID vaccination, the trial is still going on for the vaccination in case of pregnant mothers. But for the lactating women or the breastfeeding women, COVID vaccination is highly permitted and recommended. So here I have placed an evidence also, because I believe on evidence-based nursing. So here I've placed an evidence over here. This is a chart which is given by Ministry of Health and Family Welfare. You can see, if you will see the third point in this chart, it is clearly written, I don't know, okay. So this is third point over here, which is written, COVID-19 vaccination is recommended for all the lactating women. That means lactating women are free to go and take their COVID vaccinations. So please don't give it a second thought. If you are pregnant, if you are a lactating mother, straight away go and take the vaccine. Okay. So that is it for my presentation right now. Here are the standardized recommendations which I opted for. Here are the guidelines which I followed. World Health Organization, I referred Federation of Obstetrics and Gynecological Societies of India. Then Ministries of Health and Family Welfare, Indian Council of Medical Research, Centers for Disease Control and Prevention, as well as UNICEF and the Lancet. So these were my recommendations for you also, that if you ever want to know anything about COVID, pregnancy, breastfeeding, newborn care, please refer these certain authentic websites. Please do not go for those Facebook informations. Okay, so here I end my lecture. Before going ahead, just have a very quick run through, 1 minute run through of the topics that we have discussed. We started by discussing about the COVID impact on pregnant mothers, then on neonates. Then we also discussed about vertical transmission. We discussed about delayed cord clamping, which is definitely recommended even in case of COVID pandemic. We discussed about the antenatal care, intrapartum care, postpartum care. Then we also discussed about the care during breastfeeding. Then yes, definitely breastfeeding. If in case the mother is COVID positive, it is definitely allowed. Express breast milk is also allowed. And all the healthcare providers, please make sure that we do not encourage teats, pacifiers, formula milk. We try to encourage as much as possible the express breast milk only. Okay. So here I end my presentation over here just by reciting this one quote which I came across. It is written by Vivian Green. I really love this. It says, life isn't about waiting for the storm. life isn't about waiting for the storm to pass. It is actually about learning how to dance in the rain. That means we cannot wait for this COVID-19 to pass, then we'll get married, then we'll get pregnant, then we'll give birth, or then we're going to do this thing, then we're going to do that thing. Definitely life has to go on. It depends on us. How can we protect ourselves? Just by basic infection prevention protocols and measures, we can definitely live a life happily even in this case of COVID. So we can definitely learn to dance in the rain. That is it. Thank you so much. Stay safe and stay well. So if you have any queries, any doubts, then please you can ask me right now. I can see some of the comments over here. Someone is asking for to share the PPT and please share the presentations. Okay, so I'm really sorry, but I guess we are not allowed to share the presentations. But if you want any kind of information regarding this, I'm sorry. Okay, regarding this, whatever information I've given right now, if you are having any queries and you want to read more about it, my articles are clearly available on babystories.online. That is my website. So my 2 different articles are there. That is breastfeeding during COVID pandemic, and there is another article which says pregnancy during COVID pandemic. So you can clearly, I think so this BIN Academy is going to provide you the links for that. After that, you can ask them for it. Then you can go and you can have a thorough and a complete review and knowledge about it. So if someone has any doubts, then you can please ask, or you can write in the comment section over here. Thank you for your appreciation. I can read it there, or everyone is appreciating. So thank you so much. Appreciation is really good. Thank you so much. But please remember whatever I try to explain you right now, and please spread the awareness as much as you can. If you are doing it, if one person educates one person, then I would say that my talk session over here was successful. So thank you so much. I think so if someone is having any doubt, then you can please ask, or else I would like to hand over the mic to our wonderful host of BIN Academy. I'll take 1 more minute if someone wants to ask something. Or if you want to add some other points which you think that I have missed out over here, if you are obviously excellent healthcare workers working in different departments, maybe you might be teachers, maybe you might be doctors or nurses working in different sections or sectors. So if you want to add on something over here which I have forgotten, please tell me right now so that my knowledge also gets improved. See, even over here, I don't find that anyone is perfect. Everyone learns, right? So this is a platform where I am learning. I try to make you learn. So you can also take this initiative and step where I can also learn right now. So if you are wanting to add some points, yeah, please feel free to add. Don't think that I'm the speaker, so I'm going to feel bad about it, or the BIN Academy is going to feel bad about it. I don't think something is like that is going to happen. So I give you the opportunity and freedom to please say something or add on certain information. Then you can please add the information if there is anything, if something I missed out, or you want to correct me at some point, then also you are free to please correct me at that point. I know I took you a lot of time, I guess. So again, I'm asking if there's anyone who wants to add on something, or you want to rectify me, you want to correct me at any point. Okay. There's one question, ma'am, if there are any possibility COVID only in fetus, not a mother. Okay, so thank you for this question. I cannot see the name. I do not know who has asked this question. But definitely, as you asked this question, that if there is a possibility of COVID only in fetus and not in a mother, see, the evidences are still getting generated. There are no proper evidences for this. Whatever evidences have come out, it says that fetus was not seen to be affected with this coronavirus, because definitely the infection is going to get transferred from the mother to the baby. Now, as we have already discussed, that vertical transmission is not possible because cord blood virus was not found, vaginal fluid virus was not found, breast milk fluid virus was not found, and amniotic fluid also virus was not found. However, one of the research study, one systematic review was conducted by World Health Organization, where it was written that in some of the mothers' breast milk and amniotic fluid, this virus was found, but still that result was not strong enough to prove that only the fetus can get the infection. So World Health Organization and other organizations are still under study, are trying to find out proper evidences to give you an effective answer for it. But till date, what evidences are here, on the basis of that, I can say that only the affection of or the effect of COVID virus only on the fetus is not possible till date, according to the evidences. See, every day new results or new guidelines are coming up. So maybe tomorrow something comes up, then I cannot say. But for today, till now, there's no such evidence. Okay, I hope I made your answer clear. If yes, then please give a thumbs up, whosoever asked this question, because your name is not there. There's some number written, 6C6 something something. So if you have heard my question, my answer, then please just give a thumbs up so that I can understand that you are satisfied with my answer. Okay, there's one more question. If the mother is symptomatic, then what kind of medicines can we give? See, talking about the medicines over here, medicines again depend on the COVID management, but I'm not going to discuss about the medicines over here. See, we are nursing professionals and I'm a nursing professional. I am not authorized to prescribe any medicines, and I am really sorry, but I cannot take up this platform to tell you any medicine right now. It is better for the medicines that we should discuss with the doctors, because they are liable, they are authorized for these things. I am not authorized for prescribing any medicines. So definitely I'm not going to tell you any name of the medicine, but definitely, yes, what we can do is we can, the management depends upon the condition of the mother. Okay, so that is my answer to you. So if no one has the answer or the question, then I hand over the mic to the host of our today's webinar.
Thank you very much, madam. It was so wonderful session. Literally, we were flowing with your energy level. That much energetic you are. You are completely a powerful young lady. And
Thank you
actually, I
so much.
think that, yeah, ma'am. And it has widely cleared our doubts and even polished our existing knowledge to an extreme and different at an infinite height. And our academy, and we are so lucky to have a resource person like you. Your presence and experience gave more meaning to it. And once again, thanks for an excellent presentation, madam, and for such an inspiring sermon. And dear participants, we hope and wish that this webinar must have geared up your knowledge and cleared your doubts. We are very grateful to you, dear participants, for taking time off from your busy schedules to attend this webinar. And we are also thankful for your cooperation, coordination, attention, and patience that you have proved here. And we are also highly thankful to our team members who are working at the deep core to make this event successful. With these few words, dear participants, it is an honor and pleasant duty for me to notify you that after the end of this session, you all are going to receive an mail in your respective mail IDs where you will get Google Docs comprising feedback forms. There you have to give your valuable feedback, and the most critical point to note is that kindly mention the correct spelling of your names as it is going to reflect in your e-certificates. Within a couple of days, you will receive your e-certificates on your respective mail IDs, and even you can download your e-certificates from our official Facebook and Instagram page. So keep do visit our official Facebook and Instagram page for getting updated with our upcoming plans and programs. So keep track on us. And if you do have some queries or suggestions, feel free to mail us. We assure you that we will be there to pay our sincere services. And now, dear participants, let's have a glimpse on our upcoming programs. Can we have our program display on screen, please? Okay. So this is our webinar on normality test using SPSS software, which is going to held on 20th June, that is on Sunday, starting at 2 p.m. to 4 p.m. And our resource person will be Dr. Beans Fergis, who is expert in it. To be a part of this webinar, dear participants, you can contact us. We too have one more program, which is on highlight. Can we have that? Yes. So that is our elaborated version of SPSS software program. In our all programs, we assure with e-certificates, and the session is going to held on June 23 till consequently 28, and again on 30 from 7 p.m. to 9 p.m. And in this program, we offer you full version of SPSS software that will be installed in your laptop, and basic theory lectures will be scheduled to understand the concepts, and candidates will be taught how to report the findings. To register, you can mail us and contact us on our WhatsApp number. And dear participants, please save our WhatsApp number for future references and announcements of our upcoming projects. And dear participants, one more kind note, feedback link will be sent to your respective mail IDs, and even feedback form link will be sent in Zoom chat box. So now this is the time to wrap up. And once again, I thanks our resource person, the energetic young lady, Miss Itisha Rose Prasad, for her wonderful presentation. And of course, you, dear participants, for your lovely presence. So stay safe and serve to our nation. Goodbye and take care.